cardiac septa can be formed by this. This is a septum formation, the endocardium, this is invagination. So this is a formation of the endocardial cushion when there is equal expansion from two sides. If there is a single expansion, then this type of septum formation we see in the wall of the atrial cavity by the septum primum and septum secundum. So one-sided bulging is followed in septum primum, septum secundum formations, and in the endocardial cushions we see this is the two equal bulging is occurring to close the lumen. So these are the generalized formation of cardiac septums. Now one way this is the septum primum coming from where this is endocardial cushion, so septum primum is coming and they are causing enlargement. So this is how the septum formations of the primum and secundum takes place by the bulging from the divide the lumen, bulging from the roof of the common atrial chamber. Okay. Now here is one more. This is the myocardium of the cardiac heart. This is endocardium with the lumen, and this is the extracellular matrix. Okay. This extracellular matrix invaginate towards the endocardium to close the lumen of the endocardium. Okay, this is how the endocardial cushions is being formed in the atrioventricular canal. So ultimately the closure of the interventricular canal and will be formed by the pulse. That is, we see the atrioventricular canal, that is right atrium to right ventricle or the left atrium to left ventricle. They are supported by the septas. Tricuspid valve in case of the right side and bicuspid valve or mitral valve in case of the left side. So this is how the formation is occurring. Now we see the septum formation. This is the plane of the dissection. We see this is the plane of dissection. This is the septum primum, which is from the roof of the common atrial chamber. This is the ventricular chamber. This is endocardial cushions. So the gap between the endocardial cushion and the septum primum is called ostium primum. That is the right atrium, left atrium, right ventricle, left ventricle. Okay. And from the floor of the common ventricular, there is also a bulging. That bulging is due to pressurize. This is called the muscular part of interventricular septum. Now this picture we will see again in the next step, that there is a formation of the septum primum, which is ultimately we will talk about the septum intermedium, and this is the septum secundum. Now septum primum, which is coming from above, that is detached and mixed up with the septum primum of the endocardial cushion to become the septum intermedium. So septum intermedium is having the endocardial cushion component along with the septum primum, and there is a gap created between the septum secundum and the septum intermedium. This is called ostium secundum. Okay, and that is otherwise called foramen ovale. Now if this we see the picture, that this is your side of the incision. So how we will see, this is your common atrial chamber, this is common ventricular chamber, this is ostium primum, this is interventricular foramen canal, this is the ventral endocardial cushion, this is the dorsal endocardial cushion. Now the endocardial cushions are approached with each other, IV canal is separated. This is a common atrial chamber. So this is your the septum ostium septum secundum appears, and this is your ostium secundum appears. So this is the equivalent to this picture, that the septum secundum appears on the right side of the septum primum, which is been detached and attached with the endocardial cushion, forming the septum intermedium. So it is the interatrial septum is derived from three septums: septum primum coming from the roof, septum intermedium coming from the floor, that is endocardial cushion, and septum secundum, that is coming from the right side of the septum primum. So these pictures is to visualize how the septum formation taking place to close the right atrium, separate the right atrium from the left atrial chamber. Okay.